Hello, my name is Clem Turner. I'm the chairman of the Caribbean and African Community Health Support Forum. We're based here in Suffolk. All available information and national statistics shows that diabetes is 3 times more common amongst people from Caribbean and African ethnic background. We delivered 2 diabetes awareness raising courses which focus on topics such as signs and symptoms of diabetes, medication, eye care, podiatry, healthy diet, and also the importance of exercise. As a result of this, we decided to create a film to share with you our learnings as well as areas of good practice.
Is there such thing as a diabetic diet? Let's see. There's no such thing as a diabetic diet. We all need a healthy, balanced diet, all of us. So those with diabetes and those without diabetes. So it's about getting the balance what? It's getting the balance right that provides you with what? The essentials, nutrition of life. Some of those nutrients are what? We said our carbohydrates, our fats, our protein, what again? Minerals, somebody just said. Vitamins, somebody said, and very essential, and water. And that makes a balanced diet. So the best way to do this is by, somebody just said it again, eating a balanced diet. That's right. And that includes all the main foods groups, plus plenty of water. And someone said they drink plenty of water. Right. This is the question. Ruby is asking, why is she drinking so much water in the night for any of you who had diabetes before? Because the glucose level maybe is a bit high, okay? So you feel thirsty.
Hello, my name's Anne Scott. I'm a diabetes specialist nurse working at the Diabetes Centre at Ipswich Hospital. Diabetes is a condition where the sugar levels or glucose levels rise in the body and the body's not able to cope with them. There are 2 types of diabetes, type 1 and type 2. Type 1 diabetes means that there is no insulin being produced in the body, and then those people will have to take insulin injections. Type 2 diabetes is slightly different because you're producing insulin in your body, but it's not working correctly. It's a term called insulin resistance. The treatment for type 2 diabetes tends to be a healthy lifestyle, losing weight, exercise, and sometimes medication.
Okay, signs and symptoms of diabetes. High glucose level makes your blood what? Heavy, sticky, acid, and sluggish. So that person, because their pancreas is not making enough insulin, if that person hasn't got any insulin or enough insulin, obviously the glucose level is going to remain high in the blood. So that's going to give you some signs and symptoms. So that person feels they want to drink more water. Therefore, they're going to be passing more water. And then they might get itchy because then the glucose makes their urine a bit acid. So that irritates down there, whether it's male or female. And then sometimes their skin becomes dry because the glucose level in the blood is high. And then sometimes they lose a bit of weight. Sometimes they become a little bit irritated. And they may have a cut on their finger and it's not healing quickly because the glucose makes you susceptible to more infections. So all those sort of things, but they don't come one time. They may have one here and one there on their eyes as well, because we can see here with somebody who's got a high glucose level, look at the blood vessel in the eye. So if their blood is thick, heavy, sticky, and acid, then they can cause problem with your eyes because of the fine blood vessel.
There are several signs of diabetes, but if you have type 2 diabetes, the most common way you'll be diagnosed is through a blood test from your GP when you're going for other screenings such as blood pressure or cholesterol. If you don't regularly see your GP, you may notice other signs and symptoms such as going to the toilet more at night, starting to drink more, perhaps losing a bit of weight. Sometimes you may find that you have a cut or a bruise or something like that, and that takes a long time to heal, and that's very common when you have diabetes, particularly when you have high blood glucose levels. You may even develop thrush. If you do develop thrush, you must go and see your GP or practice nurse as soon as possible.
It's absolutely important that we really change our lifestyle, what we eat, do our exercising, and make sure that we are having enough water. Before you were diagnosed with diabetes, I'm sure some of you were having large fruits. Did anyone have large bananas or eat many bananas? Yeah, bananas, they are very nice. Okay, they are lovely. But now, how do you have your fruits?
I buy small bananas, I don't buy them big bananas.
Right. Is it big like this one?
Yeah, about that size.
About that size, or a bit smaller? That size?
Yeah.
That size, yeah, that's right. So this big one, and then we eat them when they are about this color. Because we know the browner they are, is the glucose level is really high. Right? So this is the best way to have them. It's yellow.
I like them that color. Could eat them.
Right? So just as what we see here, if you eat, then you need to exercise so you can have a balance. Just look at that. If it's a snack, right? So that is 300 calories, right? So we can see here what we are talking about. It adds up. 3 biscuits, 200 calories. So what do we need then? We need to exercise. So we go for half an hour walk, and that is burnt out. Or some form of physical activity. Not a walk only, but of some physical activity. Could we have the diabetes and live healthy? Look at what we are eating and see how we can manage our diabetes.
We're going to talk a little bit about the management of your diabetes. The first one is weight management. If you've put on a little bit of weight over the years, you may need to start thinking about losing some of it. It's also very important to eat healthily, and we'll talk a little bit about this later on. The other area is physical activity. Again, as we get older, we tend to be less active, and our lifestyles have changed over recent years, and we're not as active as we once were. So it's very important for you to think about trying to take a little bit more exercise, being a bit more active every day. Another area that can push your blood glucose levels up is stress. If you become very anxious or very stressed about certain situations, this tends to put your blood glucose levels up, which can make you very unhappy. Your GP is going to monitor your blood glucose levels, probably once every 3 to 6 months, and make sure that you're trying to keep to the target. The other area of great concern is diabetes medication. It has been shown in lots of research trials that people with diabetes don't take all their medication, and that eventually will do them some harm. If your medication doesn't agree with you, try and speak to your GP or your practice nurse and tell them what's happening so that they're able to change you to another tablet. 2 areas that you can make a huge improvement for your diabetes, and one of them is smoking. It's particularly bad for people with diabetes because it affects your large blood vessels. If you can, please do try and stop smoking. The other thing you need to know about is alcohol. It is full of calories, so it could add weight. The other thing that alcohol can do is affect your blood glucose levels, particularly if you're taking insulin or a drug called gliclazide.
Do we do any exercise? Do you do any exercise at all? What? Yes, I must hear a big yes.
Did you know that you're meant to take 30 minutes of exercise or physical activity a day? This can be broken down into 10 or 15-minute chunks, but you should do it at least 5 to 7 times a week if possible. What is exercise or increasing activity? Well, you could go jogging, walking, gardening, playing bowls a bit more actively, swimming. It is anything that you like that makes your heart beat a little bit faster, puts a bit of sweat on your top lip, but makes you feel that you have done something more than normal. This will help burn calories and reduce your fat.
Now, what do we mean by a healthy, balanced diet? Just as what's on that Eat Well plate, we need to have our fruits and vegetables, we need to have our carbohydrates, we need to have, if we're eating dairy products, then it's a small amount, 2 to 3 portions, like maybe you can say like a glass of milk, 200 mils is a portion. A piece of cheese that is like a small matchbox size, that's a portion, or 1 ounce of cheese. Or if you're eating 1 thing of yogurt, and that's your 3 portions of your dairy products that's gone for the day. And then we see in the middle, the purple part there is if we're having a piece of cake, or we haven't got to have it. But if we have in it, a small portion, yes? And then we look at the meat and the chicken and the fish in that area, and it's only 2 to 3 portions a day. So we see here, although fruits is loaded with essential vitamins, listen to this, and minerals and fibers, you don't want to eat too much. Because why? They are high in? Right, okay. So let's see here the portion sizes of your vegetables. How many tablespoons?
3.
Right, so 3 tablespoons equal 1 portion of what type of vegetables?
Well, if it's broccoli,
All. You see that? It doesn't really matter whether it's broccoli or cabbage, or what do you eat again? Cauliflower, carrots, peas, swede, leeks, beans, any of those is a portion. When we look here, we see West Indian portions. West Indian portions. They might have a big banana, maybe double the times of this, but they are saying, right, it's a big banana. It's too much, yeah? So you can eat any fruits, but not a large mango. Mango is a little bit too big for a portion. So a portion is about a face, because you know it's got a lot of sugar in. Sugar in the fruit turns into glucose, and that would make your blood glucose go high. So you say this is a portion. But if you're eating the whole mango, then that's maybe about 3 portions here. So we see here that is a portion, 1/2 a face. And then we look at a banana. A banana, having one big like this, it's a large portion. So we can say this might be 3 portions or 2 portions and a half. But having a banana this size, that's the portion. And then not eating the banana too brown as well, because that means the glucose level is really high. So this is the best way of having it, a little yellow. And then you know that the glucose or the sugar in it is not too high. And then we look at the apple. About 80 grams is a portion. A small apple, and that is a portion. And then a pear, lovely pear, but it's too big. And even though we cut it in half, it's still too much for a portion. That's right. So what we need to do, we can cut it in half, like that. This, you see how big it is? It's still too big. Then we can cut it down again. A piece of pear. Let us have a look and see if it's really big inside. Yeah. So we cut the pineapple, and there we are. The pineapples are different sizes, so we could say that 2 thin slices is a portion. So this we have here, 2 pieces. So because we say a large bunch of grapes is a lot of grapes, but if you eat a handful of grapes, maybe about 15. Any vegetables is 3 tablespoons equal 1 portion. Any sort of vegetables that you can see. 3 tablespoons equal 1 portion of veg. You can have it in soups, you can have it anyhow you like. We need to eat 5 to 9 portions of fruits and veg a day. And there we are. We are going to use all this dish later on. So we're going to we're doing some broccoli here. We're going to cut it up and put it in the pan. And that we're going to make a quick, like a stir fry steam vegetable. That's it. That's the making it right. And then we're going to put it over there. Yes, that's it. Yeah. Just peel it. Yeah. Put it in the tray. That's nice and sharp. All right.
Any more red? Or you having that?
Right. Let me put it in. That's it. Just 2 pieces. That's fine. Because it cooks quickly. Cut it up in dice like that. And then I just cut it up like that. Because we kind of quick frying it, so don't people. Yeah? Then we're going to use some of these lovely seasonings. Right, this is some ginger here. This is some mixed herbs. This is some turmeric. This is some seasoning salt. This is a little bit of curry, and this is parsley, and this is big thyme. So that gives the food a nice flavor. So we're going to just put a half a spoon, some mixed herbs, turmeric, paprika. We're going to give it a little tinchy bit. This is a little bit of seasoning salt because we don't want too much on it. And in a minute, we're going to use a little bit of big thyme because we smelled it all nice. Yeah? You like big thyme? Right, so we're going to put a little bit in there, not to overpower it because it's really strong. That's enough. And then that is our stir vegetable. We put it on the fire really, really high, and that's all we want in here. And just quick cooking, so we'll have a nice crisp when it's cooked. Isn't it pretty? Look at that. The color is beautiful, and you can smell the different herbs that we have just used in there. Wonderful. To put a half a teaspoon of salt because we have all those there. That's there. And then we're going to put the seasoning in. But because it's a small thing, we're going to put, and I'm going to give you the reason why we are putting the seasoning and not putting it on the chicken itself. There's a reason why I'm doing this. Who can guess why? Ah, yeah, we are doing it like this. And we mix it up like that. You could literally put your finger and taste it. If it's got enough salt, that's it. What we're going to do, we're going to put a little tinchy bit of oil. All the oil is going to get, no more. We just dip our hands so we know we're not using a whole, see? And all we're going to do is to rub it like that and lay it out. Right? 2 bay leaves, that'd be great. Yeah? Gives it a nice flavor.
Yes, that's why I asked.
Lovely flavor. Yeah. And these are one being marinated over 10 minutes. Right. And those sprigs that you were seeing, those little sticks, the thyme.
Fine leaf thyme.
Fine leaf thyme, so that's going to give it a nice flavor. Just put in a little bit of oil because we need to look at the amount of oil that we are having. And we just need to cover this with some foil and put it in the oven, just natural. Yeah? Pretty, innit? Okay, that's it. Okay, thank you, that's pretty. That's it. No oil, only water. A little bit of water. When you finish, you could put a little bit of virgin olive oil in it. But there's no olive oil, no oil at all. That's the plantain. Taking off the skin. And that is the sweet potato.
Thank you, Mum.
What is group education? Group education is important, enabling the participants to share their own concerns and challenges, where the participants learn from each other and they are not alone. Make friends, give them the opportunity to also ask questions and to answer and to learn from each other.
I wasn't aware that I was diabetic, so it's quite a shock to the system, to be honest.
I was very tired and I was drinking a lot of water and just basically going to pass water a lot. Those are the things.
Well, I noticed because I realized that he likes this amount of sweets, just sweets and sugar. I mean,
The signs and symptoms I now realise I've seen a couple of days before, which while I was watching TV, the old TV went blank and I didn't actually know what it was. I actually thought I was going blind. I just couldn't see anything.
At the moment I'm controlled with tablets and not insulin, so I'm glad for that.
well, he been to the doctor and they confirmed that. And
I was actually diagnosed in 2006 while I was in hospital for a completely different procedure.
I think I was conscious of eating too much sugary things, and that I cut down on. But then I found out it's not just sugars, it's fats as well. So that I cut down on as well.
well, I don't fry anything. I steam. Or I have chicken, put it in the oven. Roast it, or put it, I keep away from fat.
I used to drink a lot of Lucozade. I used to drink it like it was going out of fashion, basically.
Instead of eating chips now, I ate jacket potatoes, and I cut down on the rice intake and had more vegetables since then. But I went to a course and found out the things I should eat and I shouldn't.
Always use oats porridge, because I find I can go for quite a long time without being hungry. I don't eat between meals.
With the porridge, there's no sugar involved. I'd use natural fruits as the substitute for sugar, if you like. Bananas, kiwis. I do like my kiwis, so that goes on the porridge, you know.
I find by having things in moderation, you're okay. And the thing is, when you eat something, you know, you shouldn't exercise afterward and burn it off, and you're okay.
I use olive oil. I don't use butter.
I used to fry a lot of stuff like plantains. I used to fry plantain, but now I don't really, you know, fry any food as such.
I used to like chocolates and that, and I just cut it down. And after a while, your body don't miss it really. No, so yes. And sweet drinks, cut them out. And I find I drink things like cerasee, which is bitter, and I get to used to it, and that's okay.
As I say, a lot of greens, fish, and a little bit of meat, not pork, just, but most is fish or chicken.
Coming from a sporting background, which I was fit anyhow, so when I was used to exercise and used to burn it off, so you didn't used to notice the difference, but when you stop those exercises and then you still put in not so healthy food in your system, then you know you do notice that it does have an effect on you.
If I sit about too much, I find I get heavy and I can't do my exercises. And one of the things I find, where I started first, I couldn't even raise my arm or do anything up, you know, shoulder level. Now I can put my hand right over and things like that.
I go to 2 exercises a week. I go to the one here, which is very, very good, very energetic. And I've been to one now for 14 years on a Friday, so I do love that. I used to do it at home, but I get distracted with the phone ringing, the doorbell, and, you know, different things. So I make sure I get out of the house and do it.
Once a year, you're going to have a diabetes annual review. This is a bit like an MOT that you would have on your car. There are a number of things that your GP or practice nurse will be looking at. The first thing that will be done is that you'll have some blood taken from your arm, and this will be sent over to the laboratories, and a number of things will be looked at. Your cholesterol, your kidney function, and your blood glucose levels. And you'll see on the screen coming up now all the targets that we'll be asking you to meet. And hopefully your GP or practice nurse will give you your results so you can match them against the targets that we're showing you. The other things that are going to be done is you're going to have your blood pressure measured, you're going to have your waist measured, you're going to have your weight measured, and then we're going to do something called the BMI, which is the body mass index, to see whether you're overweight or very overweight. You'll also be called for some eye screening. This is done every year, and what they're going to do is they're going to take a picture of the back of your eye to make sure none of the blood vessels are broken. One of the other areas that is going to be examined is your foot. Every year you'll have your foot examined by something called a monofilament, and put it against your foot or against your toe. Tell them whether you can feel it or not. If you can feel it, that's fantastic. If you can't feel it, it does mean that you may be developing one of the complications of the diabetic foot.
So if you should notice any signs of diabetes, any signs of diabetes, do not hesitate. Do not hesitate. See your GP and he will arrange some tests for you. So early diagnosis mean what? Early treatment, that's right. So this will reduce the risk of what? Complications, right. So early diagnosis mean early treatment. So this will reduce the risk of complications.
Diabetes is a lifelong condition, and without proper management and control, it can lead to possible long-term complications, which I'm sure you've heard about, such as eye disease, heart disease, stroke, and kidney disease. However, there are certain steps you can do to help prevent complications of diabetes. One is to keep your blood glucose levels at a healthy range. Have regular physical activity, which we've already spoken about. Make sure that you attend your diabetes reviews or your MOT, and also to take the medications that have been prescribed for you. But most importantly of all is to continue leading a healthy and active life with diabetes.
We can see here what this group is all about. This group here in Ipswich. It's about working as a team, it's about helping each other.
Got some really lovely fish. Yes. I think that would really go well, you know, in the oven when we baked it, you know, in a healthy way.
Stop, you're making me hungry.
It's much better for us to bake that fish than to fry it.
Oh, yes,
Remember
And then
what
look at
we've
this
learned.
is my favorite.
You know.
Oh,
Yeah.
this is my
Smells.
I love mango. So do I.
Don't you that?
I do.
And remember, guys, the sweet potato is good for diabetics.
Yes,
Remember,
that's right. All the fibers.
because of the fibers, it helps to clean out the
Very
colon.
good.
And remember our yam. The yam is full of fibers as well.
Yes, that's right. That's
And
nice.
it's good for the colon again. You know, especially for our men. Daddy,
All for me?
it is indeed. This is very good for you, Daddy. It's very good. Virgin olive oil. It'll be good for our salads. We'll put that on the salad tomorrow. We're not going to heat that or cook that, but it's for the salad.
That's right. No planted.
Yes, and remember our brown rice. Look at that.
The fiber.
The fiber, and it's much more healthier than the white rice.